COVID-19 increases the risk of developing erectile dysfunction, ED, by nearly sixfold, according to data from the first study to investigate the association between ED and COVID-19 in young men in a real-life setting. Men with ED are more than 5 times more likely to have COVID-19. For men with a history of COVID-19, the odds ratio of developing ED was 5.66. The study, which was led by Dr. Emmanuele A. Jannini, MD, Professor of Endocrinology and Medical Sexology, University of Rome Tor Vergata, Rome, Italy, was published on March 20 in Andrology. ED can be both a short-term and a long-term complication of COVID-19, he suggests. When offered, men should have the COVID vaccination. It also gives a whole new meaning to wearing the mask up to keep it up, says Jannini. It could possibly have the added benefit of preventing sexual dysfunction. Results: 100 subjects were included in the analysis, 25 COVID positive, 75 COVID negative. The prevalence of ED, measured with the Sexual Health Inventory for men, was significantly higher in the COVID positive group, 28% versus 9.33%. Logistic regression models confirmed a significant effect of COVID-19 on the development of ED, independently of other variables affecting erectile function, such as psychological status, age, and BMI. Likewise, subjects with ED were more likely to have COVID-19, once corrected for age and BMI. Universal vaccination against the COVID-19 and the personal protective equipment could possibly have the added benefit of preventing sexual dysfunctions. COVID-19 features several clinical phenotypes, ranging from mild to severe forms. The cytokine storm may lead to the development of microvascular thrombotic and inflammatory processes, which in turn promote progression to possibly lethal pulmonary complications. Some evidence has also suggested that even silent asymptomatic forms of COVID-19 could have subclinical microvascular involvement, and that long-term cardiovascular complications could be expected in COVID-19 patients. The present study has several limitations, including its retrospective nature, the recall bias associated with the use of online questionnaires, and the inclusion of diagnosis of COVID-19 based on the response to the survey, rather than on nasopharyngeal swabs. Additionally, as the survey did not investigate the potential comorbidities, such as diabetes and hypertension, treatments, such as antidepressants, and lifestyles, such as smoking, affecting sexual health, these findings only provide preliminary evidence of the association between COVID-19 and erectile dysfunction. However, at the time of the first Italian lockdown here explored, swabs were rarely available, and an online survey was the most reliable way to obtain information on a large cohort of patients without breaking restrictions.